Hey guys, it's Libby. So today I'm here to talk about BDD, or body dysmorphic disorder, also known as body dysmorphia. Before I dive into the content, I just want to give a big thank you to everybody who helped me with this video. I reached out on Instagram for your guys' experience, your misconceptions, your facts, your own thoughts and things like that, and I gathered them all together for this video. So I just want to say a big thank you to everyone who helped me out. I couldn't do it without you, so you're the real superstar here. But let's dive in. So in short, body dysmorphia is where you're extremely preoccupied with a perceived flaw in your physical appearance. BDD is more than just insecurity. It's more than just being discontent with your body. Those two things are normal. It's normal to feel insecure sometimes. It's normal to have parts of your body that you're not a fan of. That just is what our society is. That's just how we raise humans to be. We raise them with these expectations and things, and so it's normal for you to have those experiences. Body dysmorphic disorder is more than that. It's where it goes beyond that and takes it to an extreme, essentially. I also want to say that it's different than an eating disorder. Typically, eating disorders focus on the entire body, the entire weight, the entire shape of the person. That person may have specific parts of their body that they're more insecure about, that they focus on more, but it is different than body dysmorphic disorder. Now, body dysmorphic disorder and an eating disorder can certainly be co-occurring, and that is common, but they are different things. So body dysmorphic disorder usually focuses on more than just weight. While that person might be struggling with their weight, viewing themselves as bigger than they are, viewing themselves even as smaller than they are, that's not usually the only focus of body dysmorphic disorder. In this disorder, some examples of other things people focus on besides their weight and shape are their face. The features on their face, like their nose, their eyes, their lips. They might focus on those things and blow them out of proportion more than they should be. They might focus on their skin, like acne and stuff. They might focus on their hair, thinking it looks really thin. They might be worried about their breasts. They might be worried about their muscles. And the muscles thing is something that's more common with men, but it's not just exclusively men. So looking in the mirror and thinking that your muscles look smaller than they actually are is kind of the typical situation with body dysmorphic disorder. But if you're a woman who focuses on her physique, or if you're a non-binary person who focuses on their physique, then you might struggle with your muscles with body dysmorphia disorder as well. I want to just make clear that this disorder does not come from a place of vanity. It comes from a place of low self-esteem. People struggling with this disorder may have experienced bullying that gave them this low self-esteem, whether that was from their peers or maybe from their parents or other family members. This person may have been neglected by their family. This person may have been abused. Maybe this person is a perfectionist to the extreme. Maybe this person is just really, really burdened by society's expectations of beauty and of perfection, and we all know what this is like. Maybe this person is really, really burdened by that. This disorder is linked to anxiety and depression, also linked to obsessive compulsive disorder. It kind of branches off from that a little bit because it is an obsessive compulsive thought that they're dealing with, and a type of OCD does have to do with intrusive thoughts. While this disorder is not just for people in their adolescence, people of any age can experience this. This disorder often does begin in adolescence, and I think the reason for this is because in adolescence, that's when you kind of start caring what society thinks of you, what your peers think of you, what your family thinks of you. Like, of course, you always cared somewhat, but I think that the pressure of these things really onsets in adolescence. I also want to say that this is not just for girls, women to experience. Any gender identity can experience this. Any biological sex can experience this. Something you may know about is that trans people will often deal with this as well. Imagine, whatever gender you identify as, imagine having the physical characteristics of the opposite sex. What kind of confusion that would feel like, what kind of stress, what kind of like weight on you that would be, and how likely you would be to then be critical of those parts of you. Of course, if you say you identify as a female and you've got some balls, like, you're gonna not feel super good about that, So body dysmorphia disorder can certainly be found among the trans community. Yeah. But all of that said, I want to go into some things that I collected from my followers. So I asked about experiencing this disorder and like what that's like. One person said that it can last a long time, like years and years and years, and boy is that true. This, like I said, it can be at any age, and so say it onsets in puberty, you might experience it till middle adulthood. I mean, who knows? You know, you might experience it your entire life. So this disorder is really serious because it can be really lasting. That said, people do have good days and bad days. Not every day are they going to want to die because of the way their forehead looks. But some days they're gonna like really focus on that and really hate it and really want it to change and really just be discontent with it. Something another follower told me is that they can only see themselves in parts. And obviously, of course, as it would go, the parts they hate are what they notice the most. They can't ignore those parts or try to view them differently. It just doesn't work. Another follower told me that they struggle to see really thin actors or like thin people on social media. And you know, I think that's true for everybody. You know, like if somebody is thinner than you and your goal is to be thinner, then I mean, you're gonna struggle seeing people like that. But with body dysmorphia disorder, it goes to an extreme. Like, this disorder is just taking things to an extreme, and not by choice, obviously. Who would choose that? But yeah. Another person told me that shopping for clothes is hard. Boy, oh boy, can I relate to you there. Wow, like as much as I love clothing and I love to like shop and fashion and stuff, like it is not fun sometimes. It can be really stressful, and so there's also anxiety that comes with buying a larger size. Recently on Amazon, I was buying a pair of leggings off Amazon, and I put in my like height and weight to see what size they would suggest me as, and they suggested me a medium. So I went ahead and I bought a small because I can't get myself to buy a medium. I just can't do that. Like, if I'm buying a larger size, it's because I want the thing to be oversized. Like, I want like a giant sweater or a big t-shirt or whatever. In those cases, I'll buy bigger sizes. But if it's my leggings that are supposed to be glued to me and it's telling me to be a medium, I'm like, there's no way that I'm a medium. Like, I mean, like, I believe I'm a medium, but like, I won't accept it. You know what I mean? So, yeah. Another person told me that they gained 2 pounds and that made them think that they needed to go from a size small to a size large. So their body dysmorphia said, wow, I am officially a large now. I've gained 2 pounds. This is, yep, this is me now. I'm a large from gaining 2 pounds. Does that make any like rational sense? No, of course not. We all know that 2 pounds does not bring you up 2 sizes. Another thing I asked my followers for is what kind of thoughts they experience. So one person told me that they don't actually know what they look like. Their mental image of themselves, they don't like have like a clear one. They don't know what they look like because they're so confused about what other people tell them they look like, what they think they see when they see it in the mirror, you know, like all these different perspectives. Their true belief are these thoughts that are skewed. And so when they try to think about what they look like, they're confused. They don't know. And you know, I relate to that too. Another thing someone told me is that they can't see what other people see. Like when somebody tells them they look beautiful, or when they say, oh no, you look thin, or like, your nose isn't big, you're crazy. Like, they can't see that. And sometimes they don't believe it at all, so there's disbelief there. Sometimes there's distrust there. Like, why are they saying that to me? They're just lying to me. Like, not trusting what is being told to you. And that's something that I experience too, you know? Like, if my boyfriend tells me I look beautiful, sometimes my first like gut reaction inside my heart is, why is he saying that to me? Like, what is he trying to get from me? Like, you know, like, not that I think he's actually trying to get something from me or something like that, but it's just like a thought in me that's like I don't believe that. That's a lie, you know? Like, another thought that goes on in body dysmorphic disorder is that you think that other people see this flaw, the thing you're perceiving as a flaw, and view it negatively. Like, say you're insecure about your nose. You think that everyone who looks at you is looking at your nose and thinking about how ugly your nose is, how big it looks, or whatever, you know? So, yeah. One of my followers told me that they think they look fat in clothing that they've had for years. Maybe this means that this person didn't used to think they looked fat in this clothing, but then now that their body dysmorphia has ramped up, they now think this clothing that used to be acceptable, now I look fat in it, or something like that, you know? Another thought process related to this disorder is that these thoughts you have can certainly try to justify eating disorder behaviors. Like I said, eating disorders and body dysmorphic disorder can certainly be linked. So if you've got all these negative thoughts about yourself, all these ruminations, all these intrusive thoughts, whatever you want to call them, you just might use them to justify eating disorder behavior. And is that good? No, obviously not. But it happens. I also asked for some behaviors of body dysmorphic disorder, and one person said that they work out, but that they don't see a difference. So no matter how much they work out, they still see the flaw as a flaw. They can't get past it and think that it looks better now or whatever. Another behavior is weighing yourself too often. Big one there, big one there. It's really common if you're dealing with your weight and your shape as your issue. Another common behavior is checking in the mirror too much. This can apply for body weight and shape, or it can apply for your nose, or for your hair, or for your muscles. Whatever it may be, you can probably check it in the mirror, and that's a really common behavior of body dysmorphic disorder. However, also avoiding the mirror. That is something that I do. I so rarely look at myself in the mirror. Like if I'm doing my makeup, obviously I'm looking at myself. My bigger struggle though is my body. So like if I'm like getting changed or putting self tanner on, like I just try not to look at myself too much, you know. So I definitely avoid myself in the mirror a lot. Another behavior is changing your clothes a bunch. Now this definitely applies to body weight and shape problems. But, you know, maybe you're changing hats because of the way your hair looks, or maybe you're changing hats because of the way your nose looks, or whatever, you know. So clothing you might first think is just about weight and shape. It can also be about other things that people are having trouble with. Another thing is comparing yourself to other people. That's pretty self-explanatory, just comparing your features to their features. Yeah. Another thing is being a perfectionist. Now you might be a perfectionist in general, but when it comes to whatever that aspect of your appearance is and you're a perfectionist about that, that's when it's a little bit of a problem. If you have body dysmorphic disorder, you might try to avoid social situations. You don't want people to see you and your perceived flaw, so you avoid social situations altogether, which is really sad. It's like sad that that happens, but that's part of it. It's also common to seek out cosmetic fixes. This could be anything from like makeup and clothing all the way to like a cosmetic procedure like a nose job or a tummy tuck or a butt lift or whatever. So all this bad that I've been talking about this whole video, all the negative things, is there any hope? You know, I had one follower tell me that they want to work on their self-hate, like eliminating their self-hate, and then only then can they begin to work on self-love. And I think that that is such a realistic like goal to have for yourself. First, you need to stop hating yourself, then you can learn to love yourself. Because if you're hating yourself, you can't say like, oh my gosh, look in the mirror, wow, I'm beautiful. Like, that'd be nice if you could do that and it worked for you, but it might not be a realistic way to tackle this disorder. It might be too much of a like flip-flop, you know, like it might not work for you. So if you first work on accepting yourself as you are and work on just like committing to yourself that you deserve better from yourself, and once you're done hating yourself, then you can learn how to love yourself. You may be wondering if medication is available. Well, no medication is specifically approved for treatment of body dysmorphic disorder, but since anxiety and depression can be linked to it, medications to help treat those things might also help treat the dysmorphic disorder. Another great option though is therapy. Now I have had some bad experiences in therapy. I've had some bad experiences, but I still have not given up hope that therapy is helpful. I still in me believe that therapy can be helpful to people dealing with all sorts of issues, including this one. All of that said though, that is my like summation of body dysmorphic disorder. I hope that this video was helpful, informative, interesting, entertaining, whatever it may be. I hope that it was good for you. If you have any more experiences or misconceptions or anything like that that you want to share down in the comments, feel free. I would love to see it. But if not, share this video with somebody who you think needs to see it. And yeah, so I hope you have a good one, and lots of love to y'all. Bye.